So glaucoma is a group of diseases that occur when the pressure in the eye is a little bit higher than normal. And the normal pressure under normal circumstances between 10 and 20. If the pressure goes high, it causes damage to the nerve, and the nerve that is used for vision. If you look at this eye here, there is a nerve here which takes the information to the brain so that you can recognize what you have seen. And this is the one which is mostly damaged by high pressure. So then glaucoma, then we say, is a damage to this nerve caused by high pressure in the eye.
People with diabetes are more prone to have what we call dry eye syndrome. So they will experience things like foreign body sensation, glare when looking at light, and tearing and itchiness. So and then after that, in the anterior part of the eye, there's what we call the lens. So the lens can also become cloudy over time, and this tends to happen more commonly in diabetics than in the general population.
Nilikuwa sijui kama mimi mgonjwa diabetes, nikawa nasikia tu mwili wangu hauna nguvu, nimedhoofika tu mwili, sina nguvu. Na siku moja nikasema wacha niende nikaangaliwe kama niko na ugonjwa gani, kama nilikuwa hata nafikiria ni typhoid ama malaria. Ndio nikaanza kuona sioni vizuri, macho haina nguvu ya kuona, inaendelea tu hivyo. Nikaanza kwenda hospitali Webuye. Ndio nikaonana na huyo daktari, ndiye akaniambia yeye hawezi, hiyo macho yangu hiyo inaweza kataa yeye. Sasa ni akanituma pande hii.
When this nerve has been damaged, you start losing vision. Sometimes you can be seeing distance well, but you start losing vision from the side. And sometimes you don't know, because you have two eyes, and one eye can be seeing well, and the other eye may be losing vision, but somebody doesn't know that is losing vision. So you continue to lose vision, and the vision which you lose cannot be regained.
Daktari mkubwa ametuambia ya kwamba hiyo macho moja inaweza tumia mara mbili, itumie shindani ya shilingi 10,000, ya pili 10,000. Alafu hii macho ingine itatumia 200,000. Sasa hiyo mambo imekuwa mzito. Sababu hata hiyo pesa hatuna.
Tukama kagari ya mbora.
Tuagera maulu maritu.
There are some eye drops which lower pressure, and if you're given those eye drops, then the pressure can be lowered. What you have to know is that if you start on those medication, you do not stop. You must use as you've been told. If it's once a day or if it's twice a day, if it's 2 eye drops, you must use this for the rest of your life, or until the doctor tells you not to, because it's doing something else. So eye drop is one method of treatment. The second method of treatment is laser. There are some laser procedures, what we call SLT, selective laser trabeculoplasty, which takes about 5 minutes per eye, and the doctor can apply the laser and reduce the pressure. Sometimes it can reduce it appropriately, or sometimes you still need additional medicine to keep the pressure at the required level. And once this laser is done, it's not necessary that it can protect you forever. At least it might keep you out of medication or reduce the amount of medications you take, but then you have to have a continuous checkup, maybe in case there's need for additional laser. The third one is surgery. There are several types of surgeries. The commonest one is what we call trabeculoplasty or TRAP, and this is to open a little hole which can release the water which is in the eye to keep the pressure low. Sometimes if that fails, there can be a tube which is put in the eye to drain the water out, and that is also an option. And when you go to a hospital, try to be conscious and know that there is pressure that needs to be checked. If you go to change your glasses, don't go to an optical shop and just change your glasses before you are prescribed by a doctor. get your prescription from a doctor, and then go to the optical shop to get your glasses. And the doctor, while he's checking if your glasses have changed, he'll have a chance to check your pressure. Even if they check and find you are okay now, it doesn't mean you are okay forever. You have to do a yearly checkup, depending on your risk factors. The doctor will tell you what your risk factors are. So let's be conscious about this. And if unfortunately you have glaucoma, please make sure you follow the doctor's treatment. Follow the doctor's instruction, discuss with the doctor, know what the best treatment is, and follow the doctor's instructions about how you're going to manage your glaucoma.
Once you get to know this information, it's not, it will be very important to be able to tell others who are suffering from this diabetics, so that they can be able to access this service, so that we all prevent blindness through early screening and treatment of this condition.